Welcome, everyone. We're going to give it no minutes. It's 12 o'clock on the dot. We welcome everyone. We'll start in just a second. Just allowing some of our friends to finish logging in. I see Stacy, Savannah, Trina, Misty, Randall, Andrea, Lisa, Dana, Alice. Welcome, everyone. So if we as we are logging in, I'll ask if you can please put your name in the chat and enter your organization and the location where you are coming from. I was going to say which continent. Feels like, right? But which state you're coming from. We would love to see you in the chat joining us and being able to identify you guys. We will get started in a second. So today we have a really special presentation. We got a great speaker, and I'm gonna ask you if you can locate your reactions, aka emojis. So you can clap, or you can throw hearts emojis, or you can throw some confetti emojis during the presentation. So feel free to locate those, and we will go ahead and start. The next slide. Welcome, everyone. So today we have a great presentation. We would like to say, first of all, happy Infection Preventionist Week, everyone. Clap emojis to everyone. Here you go. It's going to be a great week next week. Usually it happens the third week of October, and it's just a joy to celebrate the hard work that we all do in the field, and also those that support the infection prevention initiatives and strategies. So it doesn't matter if you are a physician, a nurse, or DON, or any discipline. Infection prevention is for everyone, so we celebrate everyone here at Telegen. My name is Jaime, and I'm the infection preventionist for Telegen, and we brought a speaker today. Her name is Tanya Sauer. She will be sharing some of her experiences as an IP and beyond that. So thank you for joining us today, and we will go ahead to the next slide. Follow us in Twitter and follow us in LinkedIn and Facebook. Please be yourself up to date with the current communication messages and tools and information that we are providing to you guys. Please follow us and be up to date with all what we offer and the different events, and make sure you are up to date with our latest. The next slide. I see a lot of people coming. Welcome again, and thank you for being here. Another way to stay connected with us is through our Telegen serve. If you are not already signed, make sure you do it. There is a QR code there for you to kind of log in and sign. You'll get notifications of critical updates related to QIN-QIO, CMS, and CDC. Please, we're going to provide you with some information for upcoming events, and it's a great platform for us to be engaged in peer-to-peer sharing ideas and information, and also best practices in infection prevention. The next slide. We have a dashboard. Please make sure that take a look at the dashboard. We have 5 different type of assessment that you will benefit from. So don't lose this opportunity. Log in and take a look at our dashboards. The next slide. Here we go. Clap emojis. Look, I see the emojis. Andrea, Barb, everyone is placing emoji. Thank you so much, guys. Let's see. Clap emojis. We're going to welcome Tanya. Tanya, it's she is a dedicated, passionate infection preventionist who has quickly made her mark in the field. And with a background in healthcare and many years of experiences, not only as an infection preventionist, but in many other roles, Tanya brings a unique perspective to the infection prevention world. Initially uncertain about the role, but she has found it rewarding. And so these presentations, we're going to share insights and reflections from Tanya and some challenges, some strategies. I'm sure you will see yourself in Tanya, which is our goal. And we're gonna please put your emojis, your questions in the chat if you can. She has been an influencer in her community, in her facility. She stays vigilant. She has mastered time management, building strong relationships among their staff. So give her a welcome, a clap emojis, clapping hands emojis to Tanya, that she will be introducing herself. Tanya, please
Well,
welcome.
you can just, sorry for my voice. My children shared something with me, so this is better than I sounded earlier. How many you can just follow me around everywhere and you can just talk accolades all the time? Like, who, like, that's very generous. Um, Also, this is my brother. It's his birthday tomorrow. So happy birthday, Matt. He lives in a long-term care facility locally for me. So I was like looking through the chat. I was like, maybe because I've been trying to find their infection preventionist. Like I cannot find their contact info. So I was like, maybe they'll show up and I'll be like, hey, if you recognize who this adorable guy is, can you just call me? Like, and we can talk. So anyways, yes, my name's Tanya, and I have been an infection preventionist for all of like 30 seconds. So last year in July. But I've been at my facility for 17 years. I worked as a CNA, and then I worked as a floor nurse, and then I worked as the clinical care coordinator, which is like a fancy term for the desk nurse who has the pulse on every resident in the facility, and kind of like coordinates all their care. And then our MDS coordinator, when this role came up, was like, hey, you should do this. And I was like, you are insane. I am never going to do that. Like, that sounds terrible. No. And then, I started praying about it. And, if you're a prayer, you know what happens. If you ask Jesus what he wants and he says, like, you're going to do it, you're like, oh, crap, now I have to do it. So that's what kind of sparked it. And I have been utterly surprised by how much I do really like it. Partly because I think sometimes we don't realize all the gifts that we have. And so when we look at a job like infection prevention, and we're like, there are all these things that, I mean, like Excel spreadsheets are not my favorite thing. And like, I love to be with my residents. And so like this kind of removes me from that. So I was kind of hesitant. Like, I don't know if this is going to play to any of my strengths. But I found myself absolutely delighted because I love learning. And so infection prevention is all about learning, and it's all about the why. And as Jaime knows, I like to ask the question why. I have sent emails back to them, which is probably the reason why I'm here, is because the squeaky wheel gets the grease, but I wasn't expecting this kind of grease. So, but just to understand why, like, especially because if you work in a place where people um, are not always receptive uh, on the first try, sometimes you get the buy-in with the why. Sometimes if you understand how important your job is, even if you feel like this is like so minute, um, you get a lot more people who are willing to go along with what you're asking. And especially, I'm sure everybody's experiencing enhanced barrier precautions. Oh my goodness, to get the buy-in on enhanced barrier precautions has been really hard. And I'm sure everybody's experienced that. And so trying to explain those nuances, and of course, then you get state come in and like not all of them are totally sure about what's going on with enhanced repercussion. So we're all kind of learning together. And I think that's the fun about infection prevention is because it's a constantly evolving field. So sorry, that was not really an introduction. That was me just rambling. Sorry. Um, you're going to get a lot of that. So welcome. You can leave soon if you weren't expecting
No,
that.
no worries, no worries. Working in infection prevention can be incredible rewarding, as you just said. But it also comes with challenges and requires a lot of motivation. And the next slide, and the passion as well, right? So the entire industry invites us to be resilient towards what's going on, the framework that we work. So it's very intense. So could you give us your thoughts on what initially drew you to infection prevention, Tanya, and what has kept you? I know you said a lot of learning, it's very dynamic. What has kept you motivated?
Well, first off, like I said, I prayed about this. And so when there's days where I'm like, Lord, can I just go back? Like, let me just go back to being the floor nurse where I just get to like hang out with the residents and like talk to them all the time. And why am I doing this? Because this is so hard some days. I have to remind myself I felt called to this, right? My why, everybody's got their why. Like, why
Yes.
why? And so if your why it and again, everybody's got different motivations. My motivation is extremely intrinsic to myself. I've worked in the same place for 17 years. I'm blessed. I work in a facility where I am literally next door to the DON and ADON. The administrator knows me a lot for good or for bad. Um, and all of the staff know me. So they know me. I'm, you know, um, but also I work in a very small facility. My facility only has 52 beds. We currently have 47 residents, and um, I run the Rosary Circle at my job. I sing in the activity. Like I don't sound like I sing now, but I sing. So like I do a lot of other things. I have hospice conversations with residents, families. Like I love my job. Like, so I love the place I work. I love the residents. Like, I never want to work in another building. Like, hopefully I'm here till like I'm 80 and they have to be like, you need to retire now. You're too old. But like, or here you can move into a bed now. Like, I love my job and I love the residents, and infection prevention is about what's best for the resident like that. And if that's my motivation, like what I do truly has a positive impact on the residents, even though a lot of it is education and auditing and feedback of staff. There's also the family education. I've sent out videos to staff or families. I send out emails to families about cold and flu season. I field a lot of phone calls about vaccines. Um, if I'm just part of me is I'm just willing to have the conversation. And so I think we
Great.
have to discover our why. Like the why is so important, and why I do this and what keeps me here is I love my residents and I really love my job. And um so I'm motivated by that, by the desire to like make our facility the best that it can be and to give our residents the quality of life that they deserve. And
Yes,
so that
that's
just
awesome.
yeah. So anyway,
Yes, that's great. That's awesome. That's fantastic. Building, I hear you saying building relationships.
yeah.
It has taken you into this path, right? The passion and it has, the buy-in and the awareness or having effective management. The next slide has led you through overcome challenges and navigate them, right? In a very positive way. So asking for the five whys sounds very root cause analysis, right? Until you don't necessarily need to go to the fifth one, but at least if you have the first one or two answer, you can definitely know where you are. So that's a great methodology to implement. It falls very well into what we do. Um, so why don't you tell us about any specific strategies or practices that you have found helpful as a new IP, especially building relationships with colleagues and ensuring compliance, hand hygiene, which is a pain for us infection preventionists, right? Separation between clean and dirty is another kind of maintaining the environment clean and reduce the possibility for transmission of infections. So would you tell us a little bit more what specific strategies or practices you have found helpful as a new IP?
Well, I watch a lot of IDPH webinars. And the other thing is, I really had to work on the time management piece because I think okay, if there's nurses in this chat, they're going to know what I'm talking about. You've gone your whole career doing one thing, and you're doing the thing based on what you were taught in nursing school. And then you get this job and you take the training, and it's like your eyes are like, what? Why didn't anybody teach me this in nursing school? This is so essential. And so a lot of that has come into play for me because I mean, I'm dealing with a lot of nurses who, I have had nurses who say, like, well, this person's had so many UTIs. We just put them on prophylactic antibiotics. And I'm like, okay, back in the day, I would have been like, yeah, sure. Now I'm like, no, no. Like, we have to figure out like why are they getting UTIs? Like, do they need more
Yes.
hydration? Do they need better pericare? Do we need to do a staff education? Like, is it actual UTI or do they have, interstitial cystitis? Like,
Yes.
so I think that's part of it. And again, most of the staff know me. And now our onboarding education, I'm not always there on onboarding days, but I created an onboarding video for infection prevention. So they already know my name and my voice and the way I look, from the get-go. And so they see me coming, and typically I try to be like, how's it going? Have you had your flu shot yet? Now we're in flu season. So have you had your flu shot?
Yes.
Facility, roll up your sleeve. Um, uh, but I so a lot of the staff are not afraid to ask me questions, and I think that's the thing. Like, being
Great.
the person to be like, I want your questions. I even want your disagreements. Like, again, enhanced barrier precautions. There's been a whole host of like, well, if this person's got a wound on their toe and it's covered, you mean I have to put the PPE on when I take them to the bathroom? Yes. Like,
Wow.
and so having to like talk through the difference between prevention of MDRO spread versus like protecting the resident and their environment from us
Mhm.
and our ability to transmit, like, again, those
Right.
are just ongoing conversations. So being willing to make conversations, um, time blocking. I literally like I'm schedule in my task. So
Wow.
NHSN reporting on
Mhm.
Mondays, facility mapping on Wednesdays. If I'm doing specific auditing, like I pencil in that time. Okay, 7:30 to 8:30 a.m. I'm walking around the facility. I'm popping into rooms and announcing, hello, do you have your PPE on?
Hello.
Like,
What
do you
an
have your hand
energy.
sanitizer? So they know
What an
I'm coming.
energy. What an
Yeah.
energy. That's fantastic. That leads us to the next slide. Um, being tenacious, right?
Mhm.
Lead by example. That's one of your feedback, right? Making sure that you participate also, right? You are part of them. Just your team feels
Right.
like you belong there and they belong to whatever you do as well. Celebrate successes, right? And improvements. That's also a great strategy for IPs. And consistency. That is 100%. It's such a great strategies to get everyone involved. And if there were any unexpected aspect of the role that stood out to you, how would you adapt? How do you adapt uh, to new events? Something that is last minute. Could you give us an insight? What you are facing something unexpected that you were not even thinking about. how's your process? How do you work that out?
Oh, well, I mean, since I'm new, I think you were talking about there's two things I want you to talk about, Jaime, later.
Yes.
Because when we were having our meeting before, you said something and it has not left my mind since because I feel like it's something that every person who does infection prevention needs to hear. And even every person, like every staff member in a facility needs to hear. Like, you have no idea how many infections you've actually prevented, like the unknown successes, because all we're
Wow.
tracking is those those breaks in infection control. We're monitoring infections. We're monitoring, breaks in protocol. Why?
Yes.
Well, because we're trying to prevent more infections, but we have no
Yes.
idea how many we've prevented. So I wanted like when he said that to me, like I legit choked up and I was like, okay, I cannot cry the first time I talked to this man. Like, don't do that. Um,
So there are
but
some, so
yeah.
infection prevention is we reduce the risk. We prevent so much that we can't see. It's not quantifiable. That doesn't mean that you are not working towards a goal, right? It's because they don't happen because you have already prevent them from happening. So that's why I encourage infection preventionists. Going to the next slide, it's you have when you face a challenge, step, take a break, take a deep breath, um, get the data that you need to see where this unexpected challenge is coming from and think through it. Use critical thinking. Infection preventionists are so good at critical thinking. And just excelling this capacity will help infection preventionists new or seasoned IPs to to feel good about their work that they are doing. So another thing is evolving guidelines. Those are unexpected things that happen. We experienced it during COVID, right? Oh, first is droplet, then airborne, then droplet, then airborne, then contact. So we were like navigating those, and we had to teach people, and we had to reassure that was the best option at that time when we had that specific information. It's not like I was right or wrong.
Mhm.
It's because the new guidelines were coming up, and that's why this kind of unstable situation of what do I do now, right? So thanks for sharing that. Any comment, Tanya?
Okay, so I just wanted to relate because you're like, take a deep breath, which is funny because I'm sure everybody knows Tanya doesn't take deep breaths. We're just like, but I like to describe it the way I describe it to new nurses. So when I was a new nurse, we had a resident who got herself into a situation that was very dire. And I got called into the room and I like looked at the situation and I said, get the nurse. And I was like, oh crap, I am the nurse. Like, so I think there's a little bit of that. Like, still for me, it's like we haven't had a COVID outbreak since January for the
Yes.
resident.
Wow.
But like, yeah, I'm anticipating now. Like we had a couple, but it was only like one at a time last year. But it's like I know that they're coming. And so part of me is like, okay, am I going to like utterly freak out like I did last year? Like we tested every single day. We did like totally flouted the COVID like
Uh,
1, 3, and 5. Diana's my administrator and she's amazing. And we were like, we're gonna test everybody every day. We were insane. So it's kind of like, okay, now I've been through it once as the IP. Now it's like, okay, all right, here we go. Like, here we go. We know there's a possibility it's going to come in. Like, you can do all the strategic masking and all the talking and like the cover your cough
yes.
and if you have the sniffles test, yada yada yada. But like, it may eventually get in. And so, am I going to like freak out again like last time? Is there going to be like, okay, no big deal, we got this. Like, it'll be okay.
Yes.
Well,
Yes.
I think you have to go through the freak out first because just like you would be as a new nurse, like you freak out. Um, eh, but then, then you have somebody fall on the floor and they crack their head open and everybody else around you is freaking out. You've been doing this for 10 years and you're like, are you okay? Okay, move your arm. All right, look at your eyes. Like
Wow.
you approach it differently. So I think be patient with yourself. Like like you hear like be calm and you're inside going, I don't feel calm. It's okay. It'll be all right. Like we'll figure it out. So
Yes, that's great that you're touching this point because that leads us into what advices do you do you have for someone that is starting the journey as an infection preventionist and who has been in the role as an infection preventionist? So
uh,
that would be think
I
about
would,
it.
yeah,
Mhm.
I would say, um, Uh, so I had the IDPH ICAR assessment like from the state come in. Like you could invite the infection prevention liaison to come in and like look through everything and like point out the areas that really needed to be reworked. Super worth it and helpful because they're not there to tag you. They're just there to like go through your stuff. And like he I really appreciate it. He's probably not on here, but Jacob Rothmeyer, thank you very much. He like sat down and was like, listen, he's like, you're looking at things that like you're 5 years away from. Like you gotta like back it up, back it up, back it up. He's like, you gotta like one thing at a time. I know there's all the things, and you're looking at all the things going, I gotta fix them all. It's not possible. It's not. So you have to be patient and be like, okay, what is the most pressing thing? And stay focused on it. Yes, there's gonna be like the dumpster fires that show up that they have to be put out right away. But like keep your eye on the one goal. Like, okay, I need to like focus on this one thing before moving on to the 8 other projects. And I think that's the hardest part for someone like me. I'm very impatient. I want to fix it all and I want it to be fixed right now. Um, which is, so this is good. I'm growing in patience. So just be patient and to be
Great,
focused on the one thing.
great. The next slide, Tanya. Thank you so much. And this kind of summarize, prioritize self-care, dedicate self-care to you, and put yourself into perspective, the amount of work that you do, and that mental health should be a priority for an infection preventionist, and build that culture of taking breaks and don't make right decisions. Quick, rapid decisions. You need to have all the elements in place. Uh, Take time to recharge, and you'll be more effective in your role when it comes to practicing infection prevention. The next slide is it's maintain a mindset of continuous learning and adaptability, as you just said, right? You love learning, you love people, you love what you do. Stay current and evidence-based. That's why we are here for you guys, Telligent, and to kind of go through the different evidence-based practices and the current practices in the IP world. We collaborate with you in anything that you would love to if you have any questions or anything like that, we are here for you. We share experiences and insights as well. That is valuable for infection preventionists because we learn from each other. The next slide. On the left, you have a day in the life of an IP. Take a look to that and see how you can kind of visualize yourself. Make Tanya, when we look at this one, he says, I don't think I have lunch. You gotta you gotta make time for lunch, guys. Okay. Understanding your role, prioritizing self-care, building resilience, and implement infection control measures are the takeaways. Please keep up with the enthusiasm of preventing and reducing risks of transmissible infections. And it was great having you, Tanya.
Yeah,
You are
sorry, I waxed long, my bad.
no worries. You
Should have
did
warned
great.
you.
You're great. Thank you, everyone, that it came today to share with Tanya her experience on infection prevention. She is a model to follow with enthusiasm, resilience, and commitment. So stay tuned. The next slide, I believe, is what we have. Here are some of our resources. And the next slide is going to be the Happy International Infection Prevention Week. If you are having some activities in your facility, enjoy them. The next
I
slide.
I have a question. I mean,
Yes.
I just want to let you know. Okay, so I'm one of those people. I literally emailed Deb, if anybody works in Illinois, I emailed Deb Birdsall about and like started a conversation. I cold called IPs in local hospitals. If you want to contact me, I'll make sure Jaime or Heather or whoever puts my email, like, because we all need help. We all need to talk to each other. So feel free to reach
Yes.
out. I may not have all the answers, but I may be able to point you in the right direction, or you may know something that I don't know and I'd be willing to learn it. So, okay, that was enough.
Great. Thank you. Will do. The
All
next
right.
slide is gonna be follow us Tuesday 15 October. I'm sorry, October 15th and 17th for the different topics. And the last October 22nd, please join us. And it was a great pleasure. Thank you, Tanya, once again for being with us, and have a great, great, happy International Infection Prevention Week, everyone. Thank you, Tanya.
Goodbye. Oh boy. Okay. Sorry.